Elaine Saxby.
Thank you, Madam Deputy Speaker. I rise for the 15th time in my time here to raise my concerns about the state of dentistry in my North Devon constituency. The first letter that I wrote on election to this place was about dentistry. And whilst I fully accept the government position that post-pandemic things have got worse, they were pretty bad in North Devon before. When I moved to Devon 6.5 years ago, it took me 2 years to find an NHS dentist, and then I had to travel 45 minutes to get there. One of my concerns with the statistics used are they compare dentists per 100,000 of population. In a very sparsely populated rural location, we might not look as much of a dental desert as some places, but at present, the nearest dentist taking NHS patients is over 100 miles away. A constituent contacted me before Christmas. With regards to the extremely limited dental care in North Devon, my partner, who suffers mental health issues which limits him from performing daily tasks and travelling, was in need of dental treatment this weekend. However, after being on hold for almost an hour, I was told that there were no appointments in the whole of North Devon and the nearest appointment was in Exeter. Travelling that distance is just not possible for someone who has mental health issues, and due to the nature of his illness, he cannot drive, and I don't either at present. Exeter is the nearest city to my constituency, over 50 miles away from most North Devon residents. Even private practices in North Devon are not able to take on the volume of patients in some parts of my constituency. I have parents writing weekly to ask what to do with their appointments, as they are cancelled because dentists are handing back their NHS contracts. And because residents in North Devon are unable to get checkups, by the time they are seen, they have extensive dental needs, costing hundreds, if not thousands of pounds. Calling us a dental desert is of no help at all. As with the structure of dentistry, dentists are not going to want to deal with the oral backlog each unseen mouth potentially holds. I welcome the new Dentistry Minister to her role and thank her for her media engagement on this issue, and very much hope that her experience will ensure that the government's plan to further recover and reform NHS dentistry is expedited, as frankly, the good people of North Devon have waited long enough to see a dentist.
Will the Honourable Member give way?
I will give way.
I'm grateful to the Honourable Member for giving way, and I recognise what she is describing in North Devon. A 75-year-old and his wife told me, they live in Tiverton, and they told me that they were contacted by their dentist, who told them that that dentist wasn't seeing NHS patients anymore. They called a further 20 dental practices and were told by several receptionists that there were no NHS appointments available in Devon at all. Does she recognise the experience of my constituents?
I thank the honourable gentleman for his intervention, and whilst recognising some of those concerns, I will come on to the response that the Minister has given me to my petition in this place, because the waitlist for dentistry is reportedly over 100,000 in Devon, and there are reports of children having all their teeth extracted, which, whilst horrific, I think we do need to encourage children and adults alike to practice good dental hygiene, as schools and nurseries have more than enough to do to educate their children without brushing their pupils' teeth every day as well. Schools in my constituency are raising concerns when I visit as to why there are no longer visits to schools by dental hygienists with plaque disclosing tablets to at least highlight where poor brushing at home might be an issue. The Marines based in my constituency raised dentistry when I visited. Every social media post I put out, on whatever topic it is, someone raises dentists. My ask to the Minister is, please can she confirm when we will see a catch-up plan, as apparently the last one got stuck at the Treasury, and as I have said before, I understand money does not grow on trees, but neither do teeth. I have presented a petition in this place about dentistry in North Devon and thank the Minister for her response, which details some improvements such as the Access Dental Helpline in Devon, but we know that even the post-COVID schemes to help dentistry catch up did not reach places that needed it most, with the majority of the funds not actually being spent on dentistry. I have listened to my ICB's plans for catching up, but I am not sure that anything I have heard fully reflects the issues around rurality and dentistry. Delivering most healthcare solutions in a rural environment is different to an urban one. The closure of one dentist can leave patients travelling an additional 50 miles in rural constituencies. As explained, popping to Exeter for treatment is not an option for many, and far too many of our health treatments involve that 120-mile round trip. We need the dentist to come to us, not us to the dentists, please. I warmly welcome the steps this government is taking to train more dentists, but as even the Prime Minister conceded when he spoke to local press on his recent trip to the North Devon District Hospital, this will not help in the short term. The opposition clearly has no plan for this and very little grasp of what rural life is even like, given most of them represent urban seats. I was delighted to hear the Secretary of State commit to fairness in rural and coastal areas. But can I ask the Minister to see if it is possible to get some dentists onto buses into rural areas, especially into our schools? Over 50% of children in North Devon have never seen a dentist. We have dentists come and see our fishermen. Why can't we arrange similar for them to see our servicemen's families, our school children, and those who simply cannot travel to an NHS dentist or afford to see one locally? I do fear that for those living here in London, the magnitude of this issue is not well understood. If you call an NHS dentist here, you will likely be seen almost immediately, probably quicker than someone will answer the phone for one back home. Ideally, we would have regular checkups with the dentist prior to getting toothache. But as even the bard said, there was never yet philosopher that could endure the toothache patiently. And my constituents and my patients is running thin with the ongoing delay in hearing that the dentist will see you now.